Governance, Leadership, and Direction, GLD Standard.
Learning objectives. Know the definition and basic principles of the governance. Learn about the criteria for setting KPIs, goals, and benchmarks. Understand the process of the supply chain. Governance, Leadership, and Direction, GLD Standard is one of the Healthcare Organization Management Standards, which is one of the Joint Commission International Accreditation Standards, which are related to providing a safe, effective and well-managed organization.
Governance policy.
Governance is a mixture of policies, systems, organizational structures, and a strategic, operational framework established by the governing body to ensure that the organization's leadership takes appropriate decisions and procedures for delivering services in an effective and accountable manner. Governance ensure the following: approving and reviewing the hospital mission, approving the strategic and operational plans, approving hospital policies and procedures, discuss the budgetary needs, approving the process of Fujairah Hospital participation in educational activities, identifying the clinical and other services of the Fujairah Hospital, approving the quality and patient safety program in the hospital, approving the scope of service of FJH departments, ensuring that effective communication is achieved and maintained throughout the hospital, monitoring of clinical and non-clinical contracts,
determining the services that can be provided by independent practitioners from outside the FJH, when applicable, and ensure that they have the appropriate credentials to provide those services and privileging them accordingly. Ensure the availability and appropriateness of organizational structure for the FJH that covers the medical, nursing and other departments. Assigning leaders to be responsible of each department in the hospital as appropriate.
Ensuring the process of assigning the medical director to lead hospital ethical committee to ensure the following as per the national and internationally practices. Ensuring the process of promoting a safety culture is accountable and transparent throughout FJH. A governance report is sent to MAHAT on a quarterly basis.
Key Performance Indicator Policy. What is the definition of Key Performance Indicators, KPI? KPI are the quantifiable measures that organization uses to track the performance over time. KPIs measures or demonstrates how effectively the organization is achieving its strategic and operational goals. How to define a KPI? Fujairah Hospital shall identify the KPIs based on their mission, services offered, and patient needs. The focus of the chosen key performance measures should be on processes and outcome that are high risk to patients and staff, provided in high volume or are problem prone. Any meaningful KPI needs to indicate levels of performance and therefore requires targets to put results into context and show if performance is on track or not. This is where benchmarking comes in because benchmarks can help to establish the appropriate targets and performance thresholds. Targets criteria. Number 1, baseline data of the average of the last quarter at least. Or adopt the targets set by central departments in Ministry of Health and Preventive for the mandatory KPIs. Number 2, specific and tied to a timeline for completion. Number 3, review on regular basis.
1. Data of a department with similar services and same defined criteria. 2. Consider itself benchmark baseline when no data is available nationally and internationally. 3. Data of a UAE hospitals with similar services. 4. International recommendations from organizations such as WHO.
Policy and Procedure Title, Supply Chain Management in Fujairah Hospital. Supply chain is the steps in moving a finished product from its source to its customer. Supply chain management is key to ensure the safety and quality of the hospital's supplies. The variety and quantity of supplies, and due to staff and resource limitation, not every supply chain can be tracked and evaluated. Key considerations in the supply chain are: 1. The risks to the product, for example, protection from losing stability and becoming contaminated. 2. The potential risk points in the steps of supply chain, for example, storage conditions, delivery method. 3. The selection of vendor, distributor. Number 4. Supply chain management is key to ensuring the safety and quality of the hospital's supplies. Number 5. Fujairah Hospital shall include all medications, medical equipment, and other items related to patient care as appropriate in the process of supply chain management. The following criteria are used to prioritize the supply chain management of items. General items criteria. Number 1. High volume. Number 2. High risk. Number 3. Impact on cost. Number 4. Any international recommendations. Number 5. Information from suppliers. Number 6. High-risk critical items. The hospital identifies the steps in the supply chain for those supply at most risk, and develop a flowchart that shows each step in the supply chain to find points that identified as a significant risk. The points in the flowchart would include the purchasing, manufacturing, warehousing, transportation, demand and supply planning.
Supply chain management at Fujairah Hospital starts with the following steps. 1. End-user involvement, which includes 1. Demand determination, 2. Item quality evaluation, 3. Supplier selection. Step number 2. Following Fujairah Hospital supply chain management rules and regulations. Step number 3. Specification and evaluation of the product. Step number 4. Time of delivery. Step number 5. Price. The Ministry of Health and Preventive Guidelines for the supply chain management requirements, which may include but no limited to 1. Good manufacturing practice GMP, 2. Free sale certificate, 3. Certificate of analysis, 4. Others when appropriate or required by related rules and regulation of UAE. Fujairah Hospital leadership shall select at least 1 medication and 1 medical equipment or device on annual basis to be tracked as an example of supply chain management process review.